Welcome everyone to Parenting During a Pandemic Facebook live stream. We're so happy that you're here with us today. My name is Ephesia and this is Rose. And we're going to be with you for the next hour and we're going to be talking about parenting during a pandemic. Throughout this presentation, please feel free to message us. We'll here try to answer your questions, and afterwards we'll give you lots of links and information to contact us afterwards as well. And just so you're aware, we are socially distanced. We have a plexiglass here between us. And as I said, we're very happy that we're able to be here tonight with you. So before I introduce ourselves here, I just wanted to let you know that we have heard from all of you and we are here to support you. So some of the things we're going to cover today are going to be about how parents are experiencing more stress during the pandemic and the kinds of challenges that have been created throughout this last 10 to 12 months from pregnancy and beyond. So we're really going to stress how parental self-care is very important at this time, and the interactions that you have with your children in everyday moments will have a lasting impact on them. So we will be talking about different parenting strategies and how to manage some behaviors that are happening. We're going to have you focus on some healthy routines, and always we're going to direct you back to the Niagara Parents Line. We're here Monday to Friday, 8:30 to 4:30 on the phone, live chat, email. You can message us through Facebook Messenger. We certainly want to answer your questions and be here to support you. And once again, we're very happy that you're here. Throughout the presentation, we'll be referring to different clinics and classes that you can message us once again through the Facebook Messenger app.
Thanks, Ephesia. So I'll just start with some introductions. I'm Rose Burns, public health nurse. I'm in the Nurse Family Partnership Program, and I've been in home visiting for quite some time. What I'll be covering, just so you know, I'll be starting in pregnancy and then moving on to a little bit of maternal mental health. And when we say maternal mental health, that also includes dads, because we all know that dads have a little bit of sympathy symptoms going on as well. And then I'll be moving along into infant mental health and covering some attachment and looking at some strategies to improve upon maternal mental health as well as dads, infant mental health, and how to increase attachment with your child. During this pandemic, you know, what I've been seeing in homes is a lot of issues around mental health, depression, anxiety, some relationship issues, a decreased income or job loss, as well as frustration, of course, and isolation, and issues around child growth and development. So we're going to address those issues with you, and we'll do the best to answer your questions, so please send your questions through.
My name is Ephesia. I'm a public health nurse in the child health program, and a lot of what I do is working with moms in the postpartum period, running Steps to Wellness group. I also teach this positive parenting program called Triple P, both individualized one-on-one as well as in a group format. And thankfully, we've been able to offer this to families throughout the pandemic in a virtual Zoom format. So I do speak to a lot of parents every day on the phone at the Niagara Parents Line, and I'm seeing the challenges that they're experiencing. So what I do hear from families is that there are increasing child misbehaviors and parental stress due to these restrictions, and the previous lifestyle has changed. So I understand, and I'm hearing that every day, that everyone has had to adapt to constant changes with limited supports. So throughout this presentation, feel free to message us. We'll try to answer your questions. We're going to be with you for the next hour to discuss parenting during a pandemic. So let's start with talking about a little bit, how are we doing? How has our family life been affected? What is worrying you specifically, and what has helped?
So we'd like to start with a little bit around maternal mental health, and while you're taking care of yourself and your growing baby, and hopefully you're eating well and getting lots of rest, it's really important to take care of your emotional health. And that's one thing we've been seeing a lot during this time, because there's so many things going on, a huge range of emotions, You could be feeling, giddy and excited one day, and then the next day anxious and weepy. So there's a huge range of emotions going on. And while this is normal for the most part, we're finding it's really intensified during the pandemic. You might feel bored, you might feel isolated or anxious even, and it's all very normal at this time. You might wonder about some changes to protocol for labor and delivery where there's no visitors are allowed, you're only one support person's allowed, and that can be stressful, right? You want to share this time with your new baby. You won't be able to have a baby shower, or at least not in the traditional way. You might not want people holding your baby, and that's very understandable. You might not feel connected to new parents due to the isolation measures that are in place now. So in terms of taking care of yourself, there's some great recommendations, and we all are doing our diligent hand washing for 20 seconds, and we're maintaining our distance, and we're using our hand sanitizer. And of course you want to avoid touching your face and touching frequently touched areas in public. Avoiding crowded places. And we all know this, but it's always nice to have those reminders, even more so now. But at the end of the day, if you're not feeling yourself, please reach out to your healthcare provider, your obstetrician, your midwife. Of course, here at Niagara Parents, we'll address any issues that you might be having. And also keep in mind, we have some great online resources as well through the public health, as well as another great one called Enjoy. And it's just a free program online with some great prenatal resources.
So what type of recommendations do we have for preschool children? How do we keep our kids safe during this time? So once again, what we're emphasizing, and a lot of parents are already doing this very well, is washing your hands often with soap and water for 20 seconds, or using an alcohol-based hand sanitizer if soap and water are not available. And I've said to families, make it fun, sing a song, dance. It's something that we need to do right now, and we can enjoy it and learn from it as well. Basic concepts of covering your mouth and nose with your arm when coughing, or sneezing with your sleeve or a tissue. These are things that you're teaching these basic skills you're teaching your child in the preschool time. Let's carry them off to when they're in school. Avoiding touching your eyes, nose, and mouth with unwashed hands. These are things we can model to our families. Your child will see what you're doing as well. And really trying to avoid contact with sick people, and remembering the social distancing, and staying home as much as possible. I know that a lot of families are already practicing this, and we emphasize that it still is very important to follow through and remember to do these skills every day. This is something you do have control over.
So what are you doing, or what have you done if you're no longer pregnant, to take care of yourself during your pregnancy? And we've got some good suggestions, and if you have some suggestions, please send them through that have worked for you or you found helpful. We always encourage taking photos. We all have phones with cameras, so you share them with your family and friends. It's just a great way to stay connected with everyone. Another great way to stay connected is going online to Early On centers, Facebook. They have great resources and great parenting programs that you can do by yourself or with your child. Healthy from the Start is another great pregnancy resource that you can, all these resources will be listed later. So it's a great pregnancy resource, free. They give you free gift cards, provide wonderful connections with parents. Journaling is another great idea. Meditation, deep breathing, and hopefully this will help you in labor as well. Fresh air, going for walks, getting a little bit of exercise in. But having said all that, if you're still not feeling yourself, please reach out to your healthcare provider, your obstetrician, or your midwife, or of course here at Niagara Parents.
And what are you doing, or did you do, to take care of yourself as a parent? So, I want to emphasize that self-care is one of the most important features of being a parent right now. As I said, I do teach the positive parenting program called Triple P. And as much as I'd be happy if you register for Triple P, I could teach you a lot of interesting strategies. The two most important strategies that is being recommended to families right now is setting realistic goals for yourself and your child, and also self-care. I can't emphasize enough that taking care of yourself as a parent will help you parent in a better way, because you want to make sure that your glass is full as well. So what I'd like you to envision with me is with spring on the way and the nesting period for birds starting mid-March, I want you to envision nests. So that nests as an acronym. So what I'm not going to go into detail about all of the letters for nests, but what it is for self-care is N for nutrition, E for exercise, S for sleep, T for time for yourself, and S for support. So I just want you to reflect on that, and there will be links afterwards. You can ask us questions. As I mentioned, self-care is one of the most important features of parenting at this time. And the one topic I wanted to just discuss a little bit with you is sleep. So how important is sleep? Like food and water, sleep is a basic necessity for your health. It's believed to be involved with brain activities such as your consolidation of your memory, learning, physical coordination, attention, regulation of your mood, temperature, and appetite. So keep in mind that an average adult needs 7 to 9 hours of sleep in a 24-hour period. I'm hearing this at the Niagara Parents Line, that families are not getting full sleep, and this is very impactful with parenting. So I just wanted you to reflect on that, and let's try some self-care. So what does self-care for parents look like? And I'm emphasizing to families, ask for help if you can. Even in the virtual way or reaching out by phone. We've lost that little bit of close contact, but it is important to share your experiences with other people. There's a lot of families that do drop-offs at the curbside or at the front porch. You want to share the load with adult family members when you can. You are not alone. We're hearing this a lot, that families are feeling stressed and that they're a little bit isolated from the context they used to have. So it is important to share your feelings, whether it's on a virtual support group. As I said, we'll share some links with you. Certainly we're here at Niagara Parents. Please call us. We're here to support you and connect you to services that could be of help to you. There are challenges and there are successes. So we welcome you to share your successes with us, and we're here to support you through your challenges. It's very normal to feel stressed, frustrated, and afraid at this time. So please be kind to yourself. Take a break when you need to. And we are hearing about guilt, but we want to try to help you manage that and set realistic expectations.
Okay, so now moving right along to infancy. So you've had your baby. Now what? It's very scary but exciting time too, right? And I often ask my clients this: do babies have mental health? What do you think? A lot of people will say no, that it's something that we only see like in young adults or adults, but babies do have mental health. And just so you know, the definition of infant mental health, it's the social and it's the emotional well-being of a child in the family relationships. It begins right at birth and it extends right through to the preschool years. So having that good foundation of infant mental health will carry them through their whole lives. There's a few things you should be aware of. Infant mental health is influenced by a few things, okay? One of them, and the most important thing, is having that secure attachment with at least one responsive caregiver. Now, it's usually mom and dad, of course, and that's great, but as long as there's one responsive caregiver, that's wonderful. Relationships that provide positive experience, that's another thing that infant mental health is influenced by. Other things are interactions where the caregiver's response is based on the child's cues and developmental needs. We'll talk a little bit more about baby's cues. And also consistent and appropriate developmental support. So as we go along, you'll see what that means. So as I said, infant mental health is influenced by attachment. Well, what does attachment mean? We often think of attachment as the same as bonding. However, there's a little bit of a difference. Bonding is, that first connection that mom feels with her baby when baby's first born, or even during her pregnancy, and of course dad too. But also attachment, you want to keep in mind, it kind of works both ways. It's not only mom's feelings or her responses to baby, it's the other way too. It's how baby reacts to mom, how baby responds to mom. So we want that attachment. We want to build on the caregiver repeatedly responding in a loving and an appropriate way to a child's distress. So for example, when they're upset, they're sick, or they're hurt, if you continue to respond repeatedly in a consistent, loving, nurturing way, you're going to build a secure attachment with your child. If you'll have lots of people telling you, hey, just let your baby cry, it's good for his lungs, or that sort of thing. In the first few months, we really don't recommend that you do that at all. You want to respond right away. By doing so, you'll build secure attachment. Otherwise, you're going to have a baby that, if anything, is going to cry even more. So reading your baby's cues are another way to recognize what a child might be saying to you. Now, obviously, baby's not going to be talking in words just yet, but they're born with these wonderful cues, and they're able to talk to you through these cues. So when I say cues, there's engaged type of cues, and what I mean by that is like baby smiles at you, reaches out to you, looks at you in a loving way. But when we see that, usually our child is trying to tell us, hey, interact with me. I love what you're doing with me. Continue to do that with me. But sometimes we see disengaged type of cues, and those are more where baby turns away or cries, pouts. So baby needs a break from whatever's going on at that time. So just take a little bit of a break, pause, and then look to your baby's cues as to whether you should continue on. Now we're finding during the pandemic, and what we're hearing from you parents, is that there's a little bit of a disconnection from their child due to the stress of parenting alone. No visitors, minimal support, lack of social interaction. So with attachment, what can you do to enhance your interactions with your baby and build attachment? And if there's any responses, we'd be glad to hear from you. And so one of the things that you're going to hopefully be doing with your newborn baby is communicating with your baby. Follow your baby's lead by copying or mirroring. And you'll see a picture that we've got here where mom is planking and so is baby. And we call this mirroring because mom is doing the same thing as baby, baby's doing the same thing as mom. They're looking at each other, they're looking affectionately at each other. What does this mean? It looks like such a simple thing, but it's actually placing a lot of value in your child, and he feels valued then as a result. So repeat and react to your child or your baby's babble. Of course, they're not going to be saying a lot, but early communication starts right at birth. Just think of the whole tennis game where someone serves and then there's a return. So when you serve the ball, you're giving your baby some words, then pause, wait for that return, and wait for baby to respond, and then again pause. So it goes back and forth, back and forth. And this, again, places value, allows your child, your baby, to develop those communication skills at a very early age. Use your child's name when you speak to your baby. That's another wonderful way. Not only will he or she learn their name, but it's also placing value on them. And use words to describe what your baby's doing. Okay, so see you're trying to put your hat on, we're gonna go for a walk when we're done, and then we're gonna come home and have lunch. Those simple things just speak volumes, and it gives them language. And I always joke around with my families and say, talk as much as you can now in infancy, because when they're a little older, they might not want to hear it so much. Learning with baby. So make their environment interesting. Babies respond to stimulation, lots of stimulation, but you also have to know when is enough. And again, looking at your cues. Are they looking away? Are they crying? Are they pushing things away? Let your baby explore through the 5 senses. And what are you doing? Is there anything that you're doing out there that you find really uses their senses? Some great examples are like singing, gently stroking, rocking, allowing them to suck. Letting a baby explore your face. A lot of parents don't realize this, but babies can see at a very early, like right from the time they're born. Might be a little fuzzy, but they can see about 6 to 8 inches from their face, and they really like to focus on the eyes. So talk to your baby, make silly faces, sing songs. They will love that. And another interesting thing is that babies have a very strong sense of smell. So keep that in mind. They know difference between mom and dad. They can smell breast milk. So all these wonderful things you probably didn't realize, but they have a very strong sense of smell. So babies learn also through play, and this is another great way to bond and attach with your child. So getting down to your baby's level, you'll see in the picture where mom and is right down there with her child, and there's also a little bit of mirroring happening here where mom and baby are gazing at each other, or baby's at least trying to look up, and mom's got her mouth open the same as baby. And this is great tummy time also for baby, where you can see this little one's trying to really hold his head up, and next will be, pushing up on his hands. But you can see that mom is getting right down to baby's level and really trying to open up some great opportunities there for play. And what can you do? You don't want to just be sitting there the whole time gazing, but I brought my little toy doll here for demonstration. We'll call him Tommy just to be fun with it. And you can see he's got some great toys here. We always recommend some great books. This is a nice texture book, so again, for the senses, right? So we can use books like that. We've also got this, books like this, mirrors. They love looking at themselves, so this is another great way to do some exploring with them. And of course, we've got, different kinds of rattles. You can make your own rattles. You don't have to, be purchasing everything. And even just stacking some blocks, this is great for exploration and play. And again, you can just use like simple household items to do things like this. So these are fun things you can do with your baby. You can banging pots and pans, keep it simple, shaking beans in a jar, dry beans in a jar. We always we're bringing books out at an early age. We even encourage during pregnancy to read with your baby, and then after baby's born, because they'll pick up on those literacy skills very, very early on. Describe what's happening in the pictures, point to pictures. You don't have to read word for word what's in the book. Just explore it with them. Let them chew on it, let them finger it, just have fun with it. So we've talked about some of the fun things you can do with babies, but babies cry. This is a strong disengagement cue. And parents get very frustrated, and we're hearing that more so now during the pandemic. Well, we always encourage that you respond to your baby right away. And like I said, if you don't respond right away, you're going to in fact cause more crying with your child. Check to see what's making them cry. It could be something very simple. They just maybe want to be held, or they want to go to sleep, or they need to be fed. Swaddling and rocking, really, babies love that motion and that feeling of feeling snug. Singing lullabies, playing soft music. What comforts your baby? If nothing works, start again. Keep calm, take a break, and put baby in a safe place. Walk away for a few seconds, but then come back, okay? At the end of the day, though, I always say trust your gut instinct. If there's something wrong, or you just don't feel right about your child, you think they're injured or ill, call their doctor.
We've been covering a lot of material up to now. Does anyone have any questions for us? Is anything that you'd like to ask?
Looks like there's some questions here online. So let's see, we have a question from Erin. My baby's only 5 weeks. I'm not sure what activities I should be doing with her. It's a tough age, right? Because you think, wow, how much can I sing or talk to her? We've listed a few things for you there, so hopefully you have found that helpful. And honestly, if one thing works 1 minute and then it doesn't, then just start with something else and go back to it until your baby's had enough. But really look at those disengagement cues when your baby's had enough. They start to cry or turn away, kind of get a cry face, that sort of thing. I think there's another question here. And if that, you can always contact our parents for more information too. We can even send you stuff on that as well. So we have a question from May. Any tips for increasing social development for babies and infants? That's a great question. We will be addressing that a little bit later on. Just a few more slides through if you want to just hold on for just a sec, but we will be addressing that question. Okay, so What I'd like to talk to you about now is we're seeing, at least I'm seeing, a lot of parents putting their child in front of a television. And I know, when May asked that question about social activities for their child, it's really easy to just plop your child in front of television. It seems to keep them amused for a period of time. But especially, really at any age, you want to reduce that amount of screen time. When we talk about screen time, we also talk about screen time with a mom or dad. And what I've been seeing a lot of is mom using her phone or tablet or computer quite a bit more now during this pandemic. You'll see the one picture there. It's a picture of mom and baby, and there's like 4 different photos there of each of them. And you'll see that the one photo, baby and mom are looking at each other very engaged. This is an experiment that was done some years ago. It was called Still Face, and I've sent through a couple links so you can check them out. It's videos, and the experimenter tells this mom at some point during the experiment, okay, be still, have a still face. And so mom, and then in the second picture, mom, you can see where she's doing that. And what starts to happen is baby recognizes, okay, something's going on here. So baby uses everything in her power to try to engage mom. She reaches out to her, she babbles, she points at things. It's really interesting to watch. It also can be a little heart-wrenching to watch because baby's trying everything. Baby gets so upset because mom's not responding. And then the good news is, of course, the experimenter says, okay, you can, start paying attention to your child now. But it's a clear example of this still face that we see. Can you think of other examples where you might see a still face? And, we've got a couple pictures there, so giving it away a little bit. But you've got mom there on her phone where she's looking at something and she's got a bit of a still face happening. You can see baby's trying to engage mom and trying to really get her attention. If you watch that video, you'll see baby starts to get upset and mom's ignoring it and having some difficulty there. But then mom does get engaged again and it's all good. But just, we wanted to point that out to you because it's something we're seeing and just something to be a little bit more mindful of. And another time we might see still faces, that last photo where mom or dad is depressed or having some issues around mental health and maybe not giving as much attention to child. So please reach out to your healthcare provider if that's the case. So there was that question from May about some social skills and ways to increase social development. What we're seeing is it's not something that is a medical term or anything, but you might be seeing out there on social media something that's called COVID baby. So we're seeing a little bit of lack of social skills, some speech and language delays, some issues around growth and developmental concerns, and this increase in fear and anxiety with new people, especially if you're going to a daycare and all that. Wearing masks can also affect this. So it's something that is very concerning and something to be mindful of. So just doing all those wonderful things like having FaceTime with family with your child or baby. You are the child's primary social person. So, and you, dad, and if there's anyone else living in the house, siblings. So just using that time to really increase those social activities and doing all those items that we listed before. I hope that answers your questions. For if you have any others, just call us at Niagara Parents. So and just in terms of wearing masks, I just wanted to point out, if a child is going to daycare, they're not able to see the daycare provider's face because they're wearing masks. Just ensure at home, you're not wearing a mask with your child. It's really important for speech and language development that they see your mouth, especially around 4 months and 18 months is very high time for language development. So keep that in mind. And but if there's any concerns, call us at Niagara Parents, and we can talk you through it and refer you on if necessary. So I just want to briefly summarize what I've talked about, that attachment is the foundation for everything, really. And by building a strong attachment with your child, you're building trust, you're building resiliency, Resiliency, yes, we're born with a certain degree of it, but it's not just something that's cut and dry at birth. It's something that can be developed over time, and it's especially now, it's very critical at this point. Attachment, just keep in mind, final thought, attachment is still very important and possible despite all the lockdown measures. And parents, more than ever before, you're an important aspect of your baby's lives.
So one of the questions that I have from parents every day almost is, how do we talk to our kids about COVID? So just wanted to point out that, as mentioned in the early infancy stage, you want to be always communicating with your kids in a level that they can understand, so developmentally appropriate to your child's age. So, before, you explain something maybe complicated to your child, find out what they think about the issue, see what their concerns are. Often, a preschool child's concerns may be related to lack of social interactions with their extended family members or not going to play groups. So you want to find out what they're concerned about. So having that developmentally appropriate chat with your child to see what they're most concerned about, in keeping their answers simple and appropriate. Always recommending that you look for information either at Niagara Region website. We do have up-to-date COVID recommendations, also World Health Organization and UNICEF. So make sure that when you're seeking information to answer to your child or even for yourself, that you're looking at reliable sources, because sometimes misinformation can cause more stress and anxiety. So we want to certainly direct you back to that. Niagara Region Public Health also has a COVID line, so please call us at that line for COVID-related questions, and Niagara Parents always for parenting-related questions. So the other thing that I do want to emphasize when you're talking to your children during these pandemic times is try not to make promises that you can't keep. And so we don't really know when things will resume in the way that we're used to. So that's one point that we're saying, is not to tell your child that things will be back to normal by your birthday. Your normal is your everyday normal. So your interaction with your child, that time that you spend, that affection, attention, those, games that you create just within your household, those are special times, and that's what we can promise, is that day-to-day interaction. So what are the top tips for parenting during this time? As I mentioned earlier, self-care is paramount, having realistic expectations for yourself and for your child, so that you're not planning goals that are very hard to achieve right now. And once again, similar to the infancy time, preschool time, I want to emphasize that you as the parent are the most important feature right now. So you may not have those social groups, you may not be traveling or doing the things that you'd like to do, but you yourself, the parent, are the biggest and most important feature in your child's life right now. So I will reiterate, please be kind and gentle to yourselves. You are very important, and I want you all to practice self-care and realize how important you are to your child's life. Just those day-to-day conversations, hugging, cuddling, high fives. I know throughout the pandemic, families have said, the social distancing, we don't want you to be socially distant from your child in the home. Hug and cuddle and show affection as you normally would. That's very healthy for a child's development. And so once again, setting goals that are realistic and organizing your home in such a way that there can be a routine as such. So meal times, nap times, sleep times, those can be a regular routine, and that gives the child security and predictability and knowing what to expect. And often behavior will improve when a child knows what to expect. And I'd like to talk a little bit about mindfulness and what that is, and how breathing, mindfulness, journaling, something where you can just take a pause and de-stress in that way. And that's something that you can also teach to your child. We will be talking about that later on as well. And then also being in the moment and finding different ways to breathe in and breathe out. Sometimes just taking a deep breath, taking a pause before you have to have a conversation with your child. You are human. You're not going to feel great all the time. as a parent, it's a rewarding job. It's challenging at times, and parents are experiencing lots of stress. So take a moment to breathe in and breathe out. I brought a few little tools that you can use for breathing. A recorder I had around the house, a harmonica. It's not always about, sometimes breathing, how do you breathe in and breathe out? I know some families will use a pinwheel, or they'll find ways just to, imagine a balloon that they're expanding. I even had this spatula with a tissue, and if you can't get to a store, you can just, you're seeing your breath. So maybe it's something, if you're trying to teach a young child how to breathe, if they can see it. I will share some videos at the end with you. And so anything that you can come up with around your house to practice breathing, but just sort of feeling your breath can kind of bring the energy down, and it'll be a little bit more de-stressed. All right? What other parenting tips are recommended? Certainly want to address feelings and feelings as a parent, as well as your feelings, the feelings that your child may have, and certainly to address that. So children have always had fears, fears about the dark, fears about maybe being separated from the parent. So you want to be able to talk about feelings with your child, the feelings that they may be experiencing, and certainly to examine, as a parent, I would really recommend that you examine sometimes how the thoughts things that you're saying to yourself, your thoughts can affect your feelings, and then that can affect how you interact with your child. So it's, again, taking a pause, being a little reflective, whether it's mindfulness, journaling, breathing. You want to take that time for yourself, because it will have an impact on your child as well. So some families tell me that they'll read a story to their child about feelings, and that kind of evokes that conversation. So it's important to be able to talk about sad, talk about mad. What do you do when you're mad or sad? Look at some of the shows that they're watching. So a conversation could be, what do you think that Sky from Paw Patrol was feeling when Rocky didn't want to share with her? So these are kinds of in-the-moment conversations with something that your child is already watching. It's a way of talking about feelings. Certainly, as I said earlier, I want you to be affectionate, hugs, high fives, anything that works best for you and your child. That really encourages good, positive behavior in your child, because they're feeling that trust, security, comfort, and you as a parent can give that to your child. And praising your child often. So we call this in Triple P, Positive Parenting Program, descriptive praise. What does that mean? Describe what you see. And so your child's playing very nicely, quietly with their blocks, saying, Johnny, what a great job you did there, stacking those blocks together. Great work. And so you're describing what you see. As a parent, you'll feel kind of warm and fuzzy when you say that as well. So it has an effect on you as a parent, and it has an effect on your child. You're sincere, you're excited, you describe what you say, you're teaching your child language, you're teaching your child respectfulness, and so this is something that you have in your control as a parent.
Ephesia, if I could just pause you for 1 second. There was a question here that we had, and it was, I hope I'm saying it right, Anadita. And so she has a 19-month-old child, and she had some questions around her child's anxiety. She said language is good, those type of things, not going to daycare, but just had some concerns around stranger anxiety and fearful, that sort of thing. And if there was any suggestions that we had, what I would suggest, all those other things that we've talked about already, but one thing probably I didn't get into too much detail is with the warmer weather now, especially getting outdoors is wonderful for not just fresh air and exercise, but just walking around the block, saying hello to neighbors, getting them used to people who live on your street, if it's possible, of course. Something that I was doing with my families when I was visiting them is driveway visits. Again, I know it's cold, and maybe with the warmer weather coming, that's something you can do just very quick, or keeping your distance and having some wonderful interactions with family or friends if possible. I don't know, Ephesia, if you had any suggestions?
Those ideas are fantastic, Rose. I think very short outings. Again, families are experiencing this lack of socializing time with their child. But those moments where if you're in the car and you're going for a short errand, maybe you're doing a curbside drop-off or pickup, there you're, when you're if you're able to do that, where you're in the car with your child, you can be having a conversation and pointing things out. So your child may not be interacting with other people per se, but they're interacting with their environment outside of their house. So just changing it up a little bit. So, you are maybe driving for a curbside pickup or driving to drop something off. So with our limitations, there still is the possibility of getting out of the house. If you're able to walk safely in your neighborhood and point things out to your child so that you're having this conversation, encouraging language. Oh, look at the, do you hear the birds singing? There's the neighbor's dog over there. So you're kind of showing your child that you're interested in the environment, and what we do have control over is our conversations. So when you spend that quality time with your child, you are promoting their safety and security, and that will come with time as well, that overcoming that sense of anxiety. But that's a great question. We do hear that a lot.
Mm-hmm. And I hate to resort to the phone use as well, but again, doing some FaceTime or having those social interactions, you with your child, with a family member or friend, is still always recommended and still good.
And maybe even if there's a story that you were to find in a book, sometimes kids it can resonate with them if they're seeing a child is experiencing a feeling. I think it's important to name it and say, Mommy feels anxious sometimes. Our Mommy feels a little anxiety. You know what helps Mommy? I do some deep breathing. I will share some links. Families tell me they're very effective. So, sad, mad, anxious, afraid. These are feelings, emotions, and it's okay to name them and give them the tools to work with them. And I think that kind of normalizes it, that we can all experience it, but we can to get better as well. So another question is, what can parents do to maintain a healthy relationship with their children at this time? I know we've been covering it a few slides earlier, but maintaining that routine as much as possible gives a child a sense of security, safety, and predictability, and I really highly encourage that. And sometimes children, they like to see it in a pictorial way, like an illustration. If they're visual learners, they're not reading, so you can actually put pictures up. This is what we're doing. Draw it out, and that way they know this is when we're waking up, this is when it's snack, this is when we play. So they kind of have a feeling for what is happening throughout the day. And as much as possible, stick to that routine. This is something you have control over, and it gives a child, as I said, a sense of predictability and safety. Some families, as I say, they put it on their fridge, they put it on their wall, and they talk about it. This kind of excitement, energy, it encourages conversation, and it also, even before a child is fully able to have long sentences and conversation, you are promoting and modeling conversation. So we encourage you to do that well before they can read. You want to be encouraging language through those little conversations you have. Talking about the routine by a pictorial graph you have on the fridge or the wall is a way of having conversation and teaching them predictability there as well. And always being kind and patient with both yourself and your child as much as you can. And certainly, as we talked earlier, when your child is having emotions such as anxiety, fear, you want to be understanding and certainly encourage conversation through a book, through say, Mommy feels that way sometimes, this is what Mommy does, this is what Daddy does. So always being calm when you speak to your child, clear and calm. This way they are understanding, similar to infancy where it's serve and return, you're teaching language and how to speak, taking those pauses by being calm and clear when you're speaking to your child to make sure that they understand. And also, as I said, with fears are very common, even before the pandemic and before the isolation that we're experiencing, children have always had fears. often when children misbehave, they don't know how to handle a situation, whether that's fear, whether it's frustration, whether they don't know how to handle that emotion. So if you can see it, if they say it, if you understand that, have a chat about it, and tell them it's okay. Feelings are okay. This is what we do, and that way they feel included. So some families ask me, why talk to your child and tell them how to cope with their fears? So you want to be able to have that conversation, and also know that when you praise your child, even for facing their fears, saying that was very good, Johnny, that you walked beside me. I know you were afraid going out, and so this way you can use that language and praise them for even small amount of overcoming an obstacle. Even a 10% improvement, that's going back to setting realistic goals. I want everyone to think about being realistic about what your child, given their developmental level, can achieve. And even a very small improvement, notice it, take note, you'll feel better about it, and your child will also feel better. Once again, being aware of the rules related to the restrictions for COVID-19, and knowing, how to social distance, how to keep clean, and how to be aware of staying healthy and strong.
And Fizia, there's just another, tied in a little bit, just another question around if they do take their children outdoors, and we talked about, when hand hygiene and sanitizer and all the rest of it, and for people that live in apartments, it might be a little bit, feeling more threatened, especially if they're using an elevator and that sort of thing. So just question concerns around what do they need to do once they return from a walk or being outdoors, especially if they're living in a condo or an apartment, and basically try to avoid touching those surfaces as much as possible. I mean, you don't have to give them a bath unless it fits in with your schedule, but really good hand hygiene, even a very young age, teaching that is always recommended. I don't know if there's anything else you wanted to add to that, Ephesia?
Certainly, we're always directing families back to the COVID line at Niagara Region Public Health. And there is a page, if you go to Niagara Region, you'll see that at the end of the presentation. Those questions are very important and very common, and you can call us and ask us. But as Rose said, the most important recommendations are hand hygiene, not touching. Let's make a game about it. We want to not touch our face when we're out, so certainly hand hygiene with alcohol-based sanitizer, and being aware that they're not going to touch their face, and the restriction of the social distancing is very important. So it sounds like that you've covered that, and really the most important thing that we want to emphasize is stay home when you can, as much as possible, but when you are out, you want to make sure that you're socially distanced and good hand hygiene practices there. I think we have another question there, Rose, as well.
If you want to give, that's probably a question you get a lot on the line. Is there a resource for newborn feeding, sleeping, play schedule for newborns? It's from Erin. I feel like I'm winging it all day.
Yeah, so as far as resources, certainly for sleeping, always I'm going to recommend call us, email us, contact us at Niagara Parents. Nurses there, they can spend infinite amount of time with you, your detailed situation, and work through age and stage. Yes, we do have links, Pediatric Sleep Council, also links that Niagara Region Public Health has an excellent link for sleeping. And newborn feeding, I think if you go to our website, there'll be information there that will speak to that topic as well. In your particular case, we would love to talk to you and just unpack it all the details, and we will be able to personalize that to exactly your needs. So we welcome your calls. We're here for you every day. And I know, I hear that the winging it Sometimes the sleeping, feeding schedule can just seem that it's just never ending. I'm going to always stress is making sure that you reach out for support, and that you have time for self-care, and see who's in your environment to support you best. You have a few more questions there?
No, just a few.
We're up to date
That's
there?
okay. You can go on. Yeah.
All right, perfect. So once again, what do children need? We Rose and I both mentioned how you as a parent are the key feature to parenting, really, those interactions that you have with your child. So they truly need your love, nurturing, the nurturing you do when you feed them, change their diaper, teach them toilet training, teach them how to sleep. Children need help to manage their emotions, to self-regulate, to know, when they're tired. So all those little moments, those teachable moments when their nap schedule is off, can't get them to sleep, they get overstimulated, they can feed off the energy in the household as well. So that's why I'm always reminding families to do this self-care time. So really what they ultimately need for a better behaved child is your love and attention, the nurturing that you do every day, and the respect, talk about that, is understanding that their feelings are acceptable to you and that you will help them work through it, and your time. It doesn't have to be an infinite amount of time. Simply 2 minutes throughout the day at different staggered, research shows that a child will respond very well. It's like an auto reset button when they're sort of getting ramped up, and if a parent notices, goes over, gives them a hug, a cuddle, reassurance, they'll be good for another period of time. So it doesn't have to be, well, I don't have an hour in my day right now, but just those small short interactions are very meaningful to a child. The research shows that a child's behavior improves when we have these short, loving, nurturing interactions with their child throughout the day, not a long period of time. And certainly always reminding people to call us at Niagara Parents Line. We can review all the new community support. Sometimes, your house, you want more than what your house has to offer. I have cans of legumes here to show you that sometimes you're not getting to a dollar store. So you might need to stack, open your pantry and stack them up. But besides that, if you there are community supports. Call us at Niagara Parents. We'll tell you what's most available to you right now and what's the best fit for you. We want to personalize that, so please call us and we'll help you the best we can. I always say to families to keep emergency contact numbers where you can easily see them on the refrigerator or somewhere handy. And again, being supportive, empathetic, and loving, what does that mean? You're being present for your child. You're supporting their growth and development where they are at their age and stage, setting realistic goals for them, and understanding that they're a child. They have to learn how to behave. They have to learn how to follow instructions. So be patient with them. Be patient with yourself as well. And so you want to make sure that even though there is increased anxiety, frustration, and stress, take that pause and time for yourself, and make sure that in your interactions with your child that you try to be as loving as you can be, but also have a little bit of mindfulness time for yourself and self-care. Mm-hmm. And as we saw earlier with the communication with an infant by mirroring, again, want to emphasize that to encourage a child's positive behavior right now, spending time communicating with your child really makes a difference. And so what do you do for a preschool child? Get down to their eye level. So you want to say their name, look in their eyes, and speak calmly and clearly. Often their behavior can improve by you just being present and saying that request slowly, clearly, and by looking in their eyes. They are distracted. They will be distracted very easily, but being aware of that and knowing that to improve your child's behavior, try to communicate with them at their level. All right. and give them time to respond. Similar to that serve and return, you want to teach them how to talk. So you want to give them time and space to communicate back, and teaching them language as well. And be aware of their cues, their tired cues, their hunger cues, and understanding and listening to them and confirming them. It looks like you're hungry, or it looks like you're tired. So you're teaching them how to recognize their cues as well. So one of the questions I get often is what does it mean to reinforce a positive? What does that actually mean? And so we want to look at what our child is doing at their age and stage, describe it, help them by teaching them new skills, only to the point that they're not able to get to that level. So a lot of times I'm seeing misbehavior in children because a parent may be expecting more than a child can do. They might need some time to teach them a little bit of that. And then obviously you want to encourage independence, but at their age and stage. And by teaching them skills in small steps, you get to that point as well. Right? And of course, keeping a routine, as I said earlier, you want to make sure that you create a routine that in the household that has a sleep schedule, their naps, their meal time, everything is on a bit of a routine as much as possible, and it does allow the child to feel safe and secure. And we're seeing that family members are isolated from their extended loved ones. So really we want to encourage, whether it's Skype, you're doing the FaceTime live or Skyping, you want to be able to stay connected to your family members, maybe writing cards or drawing pictures. There are ways to stay connected, and also teaching the child that respect and empathy, and also it's a nice part of the routine, what you can do during a day when you don't have your usual activities. Right. And certainly through visual aids and gestures, these are ways to teach a child how to communicate, and certainly this does improve their self-esteem. And it also allows them, a sense of choices and self-control. So within the work that a mother and father can do in the household with your child, you can improve their behavior simply by the routines you have for them and how you're teaching them small skills there. And certainly I want to emphasize, we talked earlier about pausing, and what does that mean? So we're human, we may feel irritated or frustrated, sometimes we'll have thoughts. Being aware of those thoughts and how those thoughts affect our feelings is important, but also knowing that sometimes your child may act in a way that could be irritating to you. Give your chance, take some deep breaths and give yourself a pause, right? You may be a little bit calmer before you interact with your child. And really, at the end of the day, what are you teaching your child? So you're demonstrating self-control, you're calming down, and then you're speaking clearly, calming, lovingly. And that's the parenting that will improve child's behavior and increase their self-esteem. And so, as I said, whatever tools you have in your home, we will share links as far as teaching a child coping strategies. It's really important. Even a preschool child can be taught about, how do we get rid of mad? Do we jump up and down? Do we color? Do we bounce a ball? You see what works with your child, what is the best fit. Every child has a unique temperament, a unique style. Know your child's temperament, know your own, see what works, and certainly finding ways to channel that energy in a positive way that's not hurtful to anyone, and always being aware of the self-talk that we're saying to ourselves as parents, and sometimes that affects how we interact with our children. So I encourage families to write out coping statements. I've got this, or I did a good job. As a parent, you can praise yourself as well. And certainly have coping strategies that you can use, that you can model to your child, that you can teach your child. We will share links with you and have suggestions. And please call us at Niagara Parents. We have a lot of ideas for you, as well as clinics and classes you can sign up for. You can do that easily through the Facebook Messenger platform, whatever is best for you. We are here for you. We have a lot of programs and services. We're hearing this in the community, so we want to offer you that support. And certainly, once again, when we interact with our children, just as in the infancy stage, you are, teaching them, emotional self-regulation, independence, and problem-solving. Certainly, your day-to-day interactions with your child does this. So there is a lot of power in the time that you spend with your child, and these key skills that you're teaching them will help them with school and help them in life. So you do have control over that. So once again, we want to look at, at the end of the day, at the end of every day, I encourage you to, praise your child for what they did well. Praise yourself for what you did well. And I had an activity where you tell your child one positive or fun thing that they did. You can ask them if they're, are able to, or just have a talk about it, so that you're sort of ending on a positive note and thinking, that they're a star, you're a star. And is there any questions? We're getting close to wrapping up our presentation. We've been so happy to be here with you today. And once again, there are a lot of services at Niagara Region Public Health with regards to COVID, with regards to parenting. It's been a privilege for us to be here today with you. Is there any questions? Is there anything else anyone would like to say?
And keep in mind, this has been recorded, so it's going to be posted on our Niagara Region Public Health site for if you've missed some of it or you want to share it with other family members or friends, feel free to do so. It will be there. And it's been an absolute pleasure speaking with you, and we hope you've gained something from this. Thanks for all your questions, and have a good night.
Be safe, be well.
Yeah, and call Niagara Parents if you have any questions.